We're talking about the new heroin epidemic, and I want to explain how this opiate affects your body and affects your mind by going through this animation. Because what does it do? Well, heroin comes from the opium plant. Seems benign, right? Well, it's not when you look at what it does to your body. Whether you smoke it, snort it, or inject it, it can have these powerful effects. Now, injecting it tends to be the greatest high because it goes immediately from your veins into your brain where something happens. That heroin latches onto opiate receptors. What happens after that? A massive surge of dopamine occurs. That gives you this intense feeling of euphoria. Nothing can stop me now. That's the pull we talk about with this drug, that intense euphoria, chasing that high. But interestingly, heroin, which is a cousin of morphine, goes to the spinal cord and blocks pain signals. So it does block physical pain. But unfortunately, that's not all it does. Heroin has a huge effect on so many organs of the body. In particular, breathing, your heart rate all decreases to the point where in some people, after an overdose, they stop breathing entirely. So you begin to understand it's not just the brain heroin affects. One of the telltale signs for me in the emergency department is heroin actually causes your pupils to go from normal to pinpoint. So if I notice someone comes in, they're not breathing, and they're unresponsive, and they have pinpoint pupils, I have a suspicion that they are overdosing from heroin or similar narcotics. What else can heroin do? It causes symptoms like dry mouth. Interestingly, heroin and its cousin drugs like morphine, prescription narcotics also decrease bowel motility. So it may seem like no big deal, but anyone who's ever suffered from this, being in the hospital from IV morphine, your bowel motility can decrease so much that you develop severe obstruction or constipation. And these are all things that someone abusing heroin has to deal with. But by and large, the number one problem with heroin and other drugs like it is that mental addiction. The effect it has on your brain can become one that overpowers every other thing and every other want in your life. You can also, by using a dirty needle, inject potentially infectious agents that can cause severe, if not life-threatening infections of the heart, amongst other things. And no one knows these effects more than someone who's used them. No one knows it more than a recovering addict like Mackenzie Phillips, because Mackenzie, that pull of heroin has caused you in the past to relapse.
Absolutely. I mean, if I don't maintain my recovery on a daily basis, slam bang, back you go, baby.
Now
it is not a joke.
People and families who are dealing with this type of thing at home, can you foresee a life, or for the average heroin addict, can they ever be clean without going through a rehab program?
Oh, absolutely. People get clean without going through rehab. I certainly don't recommend withdrawing from heroin or anything like that without, a proper detox. I mean, the thing is, people can die from alcohol detox because of seizures and that type of stuff. You won't die from a heroin detox, but you will be extremely uncomfortable.
You'll feel like you're dying.
You feel like you're dying.
People said they almost wish they die while they're going through it, which is what the physical dependence is. So there's this psychological dependence, mental dependence, addiction, and then there's the physical dependence.